I'm trying to think of like the radiologist version of that, but I can't. I just want to acknowledge that you're a radiologist.
Release the crack.
I was like ranking a detector. I was trying to be nerdy. Okay. Ooh, let's actually, so hard to do on a table, but we're gonna do it anyways. Can you bring that knee up here? Perfect. This is a shin box. So first of all, especially during pregnancy and then also postpartum, do you guys understand, like from a hip mobility perspective, this is an awesome option, okay? So kind of just go through a little progression here. Phenomenal hip range. Does anyone in the room not think you could do this and be as upright as her? Okay, yeah, it's okay. We know ourselves. So one of the things you guys will commonly see is you'll see a patient kind of like in an antalgic position here because they don't have the hip range of motion to like get that internal rotation to open up or external depending on which side. So we can always use props in something like this. So I can throw a bolster or a pillow or a pad underneath this hip as an option to kind of like create a little less flexion demand and open up a little range of motion for them there, okay? That's probably the only modification that I would do, and then if you're unable to find a good option to continue with, then I would just move on to a different option and not do this exercise at all. But starting in this position, one of the things we can do is just hang out here, but we're in a postpartum conversation, so pelvic floor is an option in this position. I love this as one position to work on that deep breath into the pelvis, okay? So I like the rubber band on the sit bones and thinking about it expanding on every inhale here, okay? You can go to Dr. Audra Lance's quote, which I'll just use her name now instead of quoting it, but you can also think about getting that breath as low as you can go here too, okay? Love this for just a breathing and kind of a reset option. And so a lot of your patients, just getting into this position will be a challenge. And so if we're in kind of like the early prepare phase, you might just be working on mobility here and breathing here. But this is also a great way for us to see glute facilitation issues. It's an assessment as much as it is an intervention or exercise. Can you come up into a kneeling position from there? No hands. Good. Next time, can we keep the feet in the shin box though? Can you go back down and do that again? So just come up to kneeling and don't, yes, perfect. Okay, so this is one of my favorite tummy time hinge activities, okay? So if they can't get up, so go ahead and, we're gonna work you today. So this is impressive, by the way. So when you guys go home to play with this later and you find yourself unable to get off the floor, I just wanna, I'm with you. That's why I'm not demoing it right now, I would just be starting to sweat for no reason and then trying to teach you all at the same time. So this is phenomenal functionality here. So if you're finding an in of like just getting some glute engagement to kick in and prop them up, that can be the exercise, is just get up to the lift. So go ahead and come back up. Again, great. Or you can start them in the tall position and then lower slower. Yes, yes, queen. Okay, I want control the whole way. So what you'll watch your patients do, especially if it's new to them, is they'll only get halfway and then they'll drop. And that's okay, we start there. You've done this before? So, but that's it, that's how we learn control. So even if I can get you for 25% of the movement, and then you let go, or even we just groove the top 25 for a little bit, like kind of finding you're in there with your patients. Does that make sense, everybody? This is awesome for hip facilitation, specifically glute. We're gonna get a lot of drive from the back leg here too, and get a little bit of quad activation.